The top stories tonight in Y News. President Rodrigo Duterte to announce tonight the community quarantine status in parts of the country from July 16. Enrollment period for public schools in the country ends today, but DepEd will still accept late enrollees until September. Moderna Phase 1 results show coronavirus vaccine is safe and induces immune response. The Research Institute for Tropical Medicine, or RITM, scales down its operations again. Thailand Prime Minister Prayut Chan-o-cha apologizes to the public for lax COVID-19 measures. Valencia, Spain collects wastewater samples to track COVID-19 spread. Good evening, Philippines and the world. Today is Wednesday, July 15, 2020. I'm Angelo Castro III. Join us in the next hour as we deliver today's top stories around the globe. We are also seen in 1,935 satellite monitoring centers nationwide and via live streaming worldwide through the UNTV News and Rescue social media accounts and our website, untvweb.com. First in the news, the Filipino nation awaits what President Rodrigo Duterte will announce tonight. Our Malacanang correspondent Rosa Licos tells us why.
President Rodrigo Duterte will announce tonight the new quarantine status to be implemented in various parts of the country starting tomorrow, July 16. According to Malacanang, the IATF has not discussed anything about further easing the community quarantine in Metro Manila to Modified General Community Quarantine or MGCQ, especially now that COVID-19 cases in the NCR keeps on increasing as well as the utilization rate of the critical care capacity.
Hindi ko po alam dahil sa huling meeting ng IATF talagang hindi po na-discuss ang MGCQ for Metro Manila.
This is the fourth month since the community quarantine has been implemented in the entire country to contain the coronavirus outbreak. Meanwhile, Secretary Roque is confident there are enough hospitals in Metro Manila to accommodate COVID-19 patients, though Health Undersecretary Leopoldo Vega admitted that the critical bed capacity for the intensive care unit is in danger zone.
Not under the system adopted by USEC Vega, no? Kasi nga, makiusap lang natin sa mga pasyente, makinig lang po tayo kung saan tayo dapat pumunta. At huwag na tayo mag-insist, huwag na tayo mag-worry. Kung puno ang isang hospital, i-refer naman po kayo sa iba pang hospital.
Rosa Licos, UNTV News and Rescue. We serve the people, we give glory to God.
Security forces will be visible in Navotas during the 14-day citywide lockdown beginning tomorrow. Meanwhile, some barangays in Caloocan and Malabon cities will also implement a lockdown. One of our senior correspondents, Ray Pelayo, will tell us why.
More than 300 strong combined forces of soldiers and policemen have been deployed in Navotas City to support the implementation of the 14-day lockdown from July 16 until July 29. Mayor Toby Chanco is dismayed how COVID-19 is spread in the city, with the number of infected Navotas residents surpassing 1,000. Some of the COVID-19 patients in the city have been transferred to the national government's isolation facilities because the city can no longer accommodate them. During the lockdown period, residents are allowed to buy basic goods during their respective schedules. The city government is also implementing a liquor ban and prohibiting mass gathering. Deliveries of food from outside the city is also prohibited. Motorists that will pass by the city will have to take C4, North Bay Boulevard, C3, Lapu-Lapu Avenue and Road 10. The city has ordered a temporary suspension of construction activities. Workers will be allowed to enter the city provided that they can present an ID or certificate of employment. Frontliners are exempted from the stay-at-home order. Meanwhile, Malabon City will implement a 15-day lockdown in parts of barangays Tanyong, Longos, Potrero, Tugatog, and Tonsuya. It will start on July 16 and end on July 30. Barangay 38 in Caloocan City is also under lockdown from July 14 to July 20, while the lockdown in Barangay 93 will start on July 12 and will be lifted on July 18. Ray Pelayo, UNTV News and Rescue. We serve the people. We give glory to God.
The country's education department did not meet its projected number of enrollees for school year 2020-2021 as of today when the extended enrollment period ends. DepEd will still accept late enrollees in public schools until September. Dante Amento tells us why.
The Department of Education or DepEd has registered more than 20.2 million enrollees across the country as the extended enrollment period ends today. 19.1 million of those are from public schools and more than 1 million enrolled in private education institutions. This number of enrollees is just 92% of the projected number of enrollees for the school year 2020 to 2021 of 21.97 million. In private schools, the enrollment turnout is just 24.3% of enrollees last year. DepEd data also show that more than 300,000 students from private schools transferred to public schools. But DepEd Undersecretary Jess Mateo says this is still high number considering the ongoing financial crisis due to the COVID-19 pandemic in which many parents have lost their jobs or livelihood.
Surprising talaga, ibig sabihin lang nito na naniniwala ang mga magulang na kailangan pagpatuloy ang pag-aaral ng mga kabataan ng mag-aaral.
DepEd adds they are still accepting late enrollees up to September.
Kasi magbubukas tayo sa August 24, no? So ang ibig sabihin lang pwede sila mag-enroll ng first week of September or second week of September para sa ganon ma-comply nila yung 80% of the calendar days.
Dante Amento, UNTV News and Rescue. We serve the people. We give glory to God.
Well, research for tropical medicine or RITM scales down its operations again. Our health correspondent Aiko Miguel will tell us why.
The country's health department confirmed that since last week, they have been monitoring the situation in the Research Institute for Tropical Medicine or RITM. This is because some of RITM staff have tested positive for COVID-19, while others who had exposure to them are undergoing quarantine.
So they had to do contact tracing, and some of these employees na kasama natin na gumagawa sa lab ay na-quarantine sila.
According to the DOH, there have been a lot of specimens submitted to the lab, and some of the lab's equipment were damaged, leading to testing backlogs in the facility. But RITM assures it has been coordinating with other licensed laboratories so that specimens to be processed would not pile up. The Prime Lab will still accept samples of inpatients from other hospitals and LGUs because it is not completely shutting down.
We are now coordinating with the Philippine Red Cross para yung backlog na iba pakiusap natin sa kanila. Yun pong mga pag nag-scale down, ay hindi ibig sabihin totally wala silang gagawin.
Meanwhile, there are more than 30,000 active COVID-19 cases in the country. These are potential individuals who can transmit the virus. According to the DOH, a spike of cases is recorded daily, which is why the public is advised to be extra cautious.
Marami po ang nagsasabi, lalong-lalo na yung mga ating mga clinicians sa mga ospital, na marami po silang mga na-admit ngayon na walang talagang pinuntahan kung hindi yung essentials lang. Pumunta lang sa grocery, pumunta lang at bumili ng gamot, at yun lang ang mga naging exposure, pero sila ay nagkakasakit. Stay at home kung hindi naman po essential ang kailangan gawin sa labas ng bahay para po mas mapigilan natin ang pagtaas ng mga kaso.
Aiko Miguel, UNTV News and Rescue. We serve the people. We give glory to God.
A national government official says that healthcare providers must be the ones to lead in the transfer of a COVID-19 patient from their home to a quarantine facility. Lea Ilagan tells us why.
Department of Justice Secretary Minardo Guevara believes that health workers instead of policemen must lead the transfer of COVID-19 patients from their houses to quarantine facility. In a statement, Secretary Guevara says the health workers are more knowledgeable when it comes to house-to-house visits and to which quarantine facility the patients will be transferred. The Justice Secretary adds that police personnel's house-to-house visit to COVID-19 patients was not tackled in their IATF meetings, but he explains that there is a legal basis for the transfer of patients from their house to a government quarantine facility under the mandatory reporting of notifiable diseases law. It states that a person needs to report himself if he has a contagious disease that will affect the community. Joint Task Force COVID Shield Commander, Police Lieutenant General Guillermo Eleazar says police personnel will just serve as an escort of city health officers.
Ang role ng ating PNP ay para tumulong sa ating LGU through their health officers or workers. Kasi sila nakakaalam kung sino yung mga pasyente na positive na after testing at sila ngayon ay mas maganda na dalhin dun sa ating mga isolation facilities.
Eleazar also explains that a COVID-19 patient needs to be in a quarantine facility if he cannot be isolated inside his home. This is to avoid infecting other family members.
Hindi naman pinagbabawal na magkaroon ng home quarantine sa kanilang bahay lamang. Merong criteria kasi na pinalabas yan, na meron sayang sariling silid, meron sariling palikuran, at walang kasama doon na pwedeng delikado kung mahawaan like itong mga putis, itong mga matanda, at iba pang mga may sakit.
Eleazar is hoping for the cooperation of the public.
Tayo ay nasa public health emergency at meron tayong batas na pwedeng pagbasihan para po mapailan na kaso o resuhin, pero hindi na dapat natin gawin yun. Pero kagaya sinabi ko nga, kung upon the assessment of the worker concerned na kailangan dalhin yun dahil manganganib hindi lamang yung sarili niya kundi yung ibang tao, then we will do that.
Police personnel who will serve as escorts of the health officers will be wearing PPE for their protection. Leia Ilagan, UNTV, News and Rescue. We serve the people, we give glory to God.
Department of Public Works and Highways Secretary Mark Villar has tested positive for COVID-19. The Secretary announced this through a Facebook post after he received his COVID-19 test result today. Earlier this week, Villar was named as the government isolation czar who will oversee the capacity and building of quarantine facilities across the country. He is the third cabinet member to contract the virus, following Education Secretary Lenore Briones and Interior and Local Government Secretary Eduardo Año, who have both recovered from the disease.
U.S. researchers reported on Tuesday that Moderna's COVID-19 vaccine candidate showed it was safe and provoked immune responses in all 45 healthy volunteers in an ongoing early-stage study. Nariel Latsa will tell us why.
No study volunteers experienced a serious side effect, but more than half reported mild or moderate reactions such as fatigue, headache, chills, muscle aches, or pain at the injection site. This was found in Moderna Inc.'s experimental vaccine against SARS-CoV-2 for COVID-19 mRNA 1273. These were more likely to occur after the second dose and in people who got the highest dose, the team reported in the New England Journal of Medicine. Moderna was the first to start human testing of a vaccine for the novel coronavirus on March 16, some 66 days after the genetic sequence of the virus was released. The U.S. federal government is supporting Moderna's vaccine with nearly $500 million and has chosen it as one of the first to enter large-scale human trials. A successful vaccine could be a turning point for Moderna, which has never had a licensed product. Moderna's shots, when injected into people, the vaccine instructs cells to make proteins that mimic the outer surface of the coronavirus, which the body recognizes as a foreign invader and mounts an immune response against. The results released on Tuesday involve 3 doses of the vaccine, tested in groups of 15 volunteers aged 18 to 55 who got 2 shots, 28 days apart. The groups tested 250 micrograms of the vaccine. The team reported that individuals who got 2 doses of the vaccine had high levels of virus-killing neutralizing antibodies that exceeded the average levels seen in people who had recovered from COVID-19. According to Dr. Lisa Jackson, who leads the study, they didn't see any events that are characterized as serious adverse events or reactions that require hospitalization or result in death. In June, Moderna said it selected the 100 microgram dose for its late-stage study to minimize adverse reactions. Moderna said at that dose, the company is on track to deliver about 500 million doses per year and possibly up to 1 billion doses per year starting 2021. From the company's internal U.S. manufacturing site and strategic collaboration with Swiss drug maker Lonza. Dr. William Schaffner, a vaccine expert at Vanderbilt University Medical Center who was not involved in the study, said, "This is a good first step. A little fatigue and headache and myalgia and pain at the injection site is a small price to pay for protection against COVID-19, he adds. In April, Moderna expanded the phase 1 trial to include adults over 55 who are more at risk of serious disease, with the aim of enrolling 120 volunteers. Moderna said it will follow to study volunteers for a year after the second shot, to look for side effects and check how long immunity lasts. Mariela Toza, UNTV News and Rescue. We serve the people, we give glory to God.
And let's now take a closer look at the updated count of coronavirus cases around the world. The COVID-19 pandemic has now reached a total of over 13.3 million confirmed cases in 188 countries, regions, and sovereignty. The fast-spreading disease has claimed over 578,000 lives, while close to 7.4 million patients across the globe have recovered from the new coronavirus infection.
Meanwhile, the country's Department of Health says that 1,392 new cases were reported today based on the total tests done by 73 out of 82 current operational labs. That raises the total confirmed cases of coronavirus infection in the Philippines to 58,850. Of the new cases, 708 are from the national capital region, while 198 were reported in Cebu and the rest from Iloilo, Laguna, and Cavite. We have lost 11 more patients. The country as of today has 36,260 active cases. 90.6% of those active cases are mild. Through our fervent prayers, medical interventions, and sacrifices of our medical frontliners, 517 more people have won their battle against the invisible enemy. That brings the total recoveries nationwide to 20,976. Thanks be to God.
The health department will now include in the subgroups of those prioritized to be tested for COVID-19, drivers, security guards, and other economy workers based on the updated testing guideline that will be released this week. The DOH, on the other hand, reminds those with exposure to COVID-19 patients to isolate while awaiting their test results. Aiko Miguel tells us why.
Aside from the elderly, the vulnerable sector, and frontliners, there will be additional subgroups that will be included in the expanded COVID-19 testing of the Department of Health. 4 subgroups will be included on the list that will be prioritized to be tested in licensed testing laboratories in the country. According to the DOH, Subgroup G includes residents of areas with clustering or active transmission of COVID-19. Subgroup H includes frontliners in tourist zones. Employees of manufacturing companies and public service providers are included in the Subgroup I, and Subgroup J includes economy workers like drivers of public utility vehicles, conductors, pilots, waiters, restaurant managers, cashiers, bank tellers, teachers, and even security guards. The DOH explains the inclusion of other subgroups means that the testing capacity in the country is continuously expanding. This week, the DOH is set to release the updated testing guidelines.
Alam natin na gusto na natin unti-unting buksan ang ating ekonomiya, and this is part of how we will be opening our economy.
Meanwhile, the DOH reminds those with exposure to COVID-19 positive patients awaiting their test results to undergo quarantine even though they are asymptomatic. This assures they will not be silent spreaders of COVID-19.
Even if the results are not out, they have to comply with the quarantine procedure of having to be isolated for 14 days. So, yun ang lagi namin ilalagay, no, at in-emphasize. Hindi pwede na porke nag-aantay ka ng test mo, lumabas ka na. Hindi pwede yun. Kailangan mag-comply ka.
Aiko Miguel, UNTV News and Rescue. We serve the people. We give glory to God.
Health Secretary Francisco Duque III stated during the pre-SONA forum this afternoon that the country has successfully flattened the curve since April. According to Secretary Duque, the metrics to prove this is the slowing of case doubling time in the country. Secretary Duque adds even the mortality doubling time in the Philippines has slowed down.
I mentioned that on the basis of our case doubling time that has actually become longer beyond 7 days. It's now anywhere from 8 to 12 days. And this is an improvement from the initial phase of the outbreak when the case doubling time was about 2.5 days. So over time, we have managed to stabilize the number of new cases being reported at anywhere 200, 220 cases per day. This is the clarification that I would like to make.
But according to a tweet, former Special Advisor to the COVID-19 National Task Force, Dr. Anthony Liachon, says the country has not flattened the curve because of the surge of COVID-19 cases, death cases, and the current status of the critical care utilization in Metro Manila and Cebu. Dr. Liachon adds the DOH has to review data to guide the IATF, the government, and the public. In a tweet this afternoon, Secretary Duque said that cases have decreased since enhanced community quarantine was implemented in March. Cases surge due to the expanded testing capacity in the country and the reported community transmission of the deadly virus when restrictions were eased. Secretary Duque also clarified there has been a bend in COVID-19 cases in the country.
The Central Office of the Civil Service Commission in Quezon City will have to undergo disinfection measures starting today until Friday, July 17. According to CSC Commissioner Attorney Eileen Lizara, this comes after an employee manifested. The said employee is set to undergo swab testing. The public is advised not to visit the building premises during those 3 days and instead transact online. Those who have appointments are instructed to wait for further rescheduling announcements. Meanwhile,
for a Filipino health expert, there is no need to use a barrier between the motorcycle rider and his back rider. This comes after the government has approved back riding, but with a policy of using a barrier. Jo Anano tells us why.
An expert from the Philippine Society of Microbiology and Infectious Diseases says that wearing a face mask and hand washing is enough to prevent a possible transmission of COVID-19 between a motorcycle rider and his back rider. Dr. Arthur Desi Roman, an infectious disease specialist, explains that COVID-19 can be transmitted through direct contact or respiratory droplets from an infected person. The wearing of face mask and regular hand washing prevents the rider from contracting the virus. Dr. Roman argues that using a barrier for motorcycle back riding is not needed.
So the primary mode of transmission is contact and respiratory droplets. So the way we advocate to prevent respiratory droplet transmission is the wearing of mask, both by the rider and yung driver ng motor tsaka yung rider sa likod. So as far as the contact is concerned naman po, remember contact is also a mode of transmission. Then after riding, that we can always perform yung hand hygiene with alcohol na 70%.
On Monday, law enforcers will start apprehending motorcycle riders who will violate the protocol of using a barrier. Not only the police but also traffic officers from the MMDA will apprehend violators. MMDA General Manager Jojo Garcia reiterates that the policy will benefit the motorcycle rider.
Sabi nga natin, kung tunay talaga magkasama, wala tayong problema, o magkasama sa bahay, wala tayong problema. Pero alam naman po natin yung iba nating mga pasaway na mga kababayan, magpapalusot yan, papagawa ng ID. So para maproteksyonan na lang lahat, lagyan natin ng shield para kung sumuway ka man, hindi makakahawa.
Both the motorcycle rider and the back rider are also required to wear a face mask and a helmet apart from using the approved design of barrier between them. Those who will fail to comply with the policy will be charged of violating Republic Act 1132 or the Mandatory Reporting of Notifiable Disease and Health Events of Public Health Concern Act with a penalty of 1,500 to 5,000 pesos. Joanna, UNTV News and Rescue. We serve the people, we give glory to God.
And the Department of Trade and Industry clarifies that bartering goods or personal items is not prohibited in the country, but profit makers who use the barter system must register to authorities. Vincent Arboleda will join us tonight to tell us why live. Yes, Vincent, good evening.
William, the Department of Trade and Industry acknowledges bartering as a form of trade, and it has been the recourse of several individuals during this time of pandemic as many have lost their jobs and livelihood. That is why Trade Undersecretary Ruth Castelo clarifies that barter is legal in the country.
Yung sinasabi ni Secretary Lopez na illegal if it is done in the course of business. Pero if it's personal, like example, second-hand items, personal items that you would trade with your friends or within a community, that's allowed.
As proof, Yuse Castelo cited the barter ports located in Sulu and Tawi-Tawi where Filipinos engage in barter trade with Malaysia. But Yuse Castelo says they do not highly recommend bartering, especially at the international level. But when it comes to personal barter or exchange of goods within the community, Castelo says this can somehow help the people attain their needs, especially in the middle of the COVID-19 crisis.
Pagka naging international na or cross-border na siya, merong repercussion yan because it might be an avenue for dumping. Ida-dump sa atin yung goods nila, hindi ba? And then yung imported materials or imported finished products, nakaka-escape sa taxes. If there is limited funds ngayon ng mga tao individually or per family, it will help them because they can get the goods that they need by trading or bartering with the next person na hindi naman kailangan yung kailangan nila. It's going to help them.
But when it comes to those who earn or get a profit through the barter system, whether they be an individual or a company, the DTI advises the public to register their business and trade to authorities because there are corresponding taxes. The Trade Department also warns the public not to trade contraband such as unlicensed firearms, drugs, or prescription medicines. Yuse Castelo says, aside from online selling, they will also monitor online barters to make sure that no one will abuse the system and evade paying taxes. For businesses and individuals who wish to earn a profit through the barter system, DTI advises to register their businesses to the Bureau of Internal Revenue and their corresponding local government unit to make their trade legal. William?
Yes, Vincent, will barter trade have an effect to our economy?
William, according to Yuse Castelo, DTI sees barter as a temporary way of individuals to attain their needs, but does not. DTI says this will not have much effect on our economy.
Okay, Vincent, are there any feedbacks coming from those who engage in the barter system?
Yes, William, the Iloilo barter community and its affiliates have released an official statement regarding this issue on the barter or the use of barter as trading. They said that they stand by the legality of the barter system according to the civil code, but they are also not here, or they specify that what they do is not for profit or business purposes, but to enable the people to acquire what they need through the barter system during this time of pandemic. William?
Yes, thank you, Vincent, for that report. Meanwhile, thousands of netizens find support amid the crisis from online barter trading of products and goods. But a trade expert reminds barterers to observe vigilance in any online transactions. Let's find out why from Asher Kadapan Jr.
Barter trading has been part of the ancient Philippine history, but with high technology in the modern days, Filipinos adopt the barter systems through the online platform.
Since online seller ako, ang naitulong sa akin ng barter or trading o yung pagpapalit ng mga produkto is nagagamit ko na siya dahil yung mga na-stock kong mga binibenta before, so napapalit ko ng mga pagkain, napapalit ko ng mga gamit na kailangan ko.
Iloilo Barter Community or IBACO is one of the several barter groups in social media with more than 90,000 members actively participating in the trading of different products such as mobile phones, bicycles, clothes, food, and many more slightly used appliances.
Karamihan sa atin wala tayong regular income nung nag-start ng ECQ. Pero marami tayong gamit sa bahay na hindi na muna natin gagamitin o hindi na natin gagamitin na nagbigay ng buhay ulit sa atin na ipalit sa pagkain o sa ibang mga necessity na kailangan natin o ng pamilya natin.
IBACO has recorded about 500,000 transactions within their group in just about 2 months of operation. Despite the rules implemented among the barterers, its founder reminds its members to always take extra precautions in dealing with other traders online.
Maging vigilant lang po tayo sa ating binabarter kasi always do the checking ng mga items po. If that is food, double check niyo po yung expiry. And always abide by the government safety requirement in meeting up.
Asher Kadapan Jr., UNTV News and Rescue. We serve the people, we give glory to God.
The coronavirus pandemic has displaced workers from their jobs. Because of the need to survive, some are now seeking ways online to earn money. Even a famous Filipino rapper is now venturing into selling online food. Arlene Delgado has the story.
The COVID-19 pandemic has brought disruption to almost everybody's lives. Thousands of jobs are gone due to business closures in most industries. That is why some of our kababayans are looking for ways to earn money in order to survive the ongoing crisis. Many Filipinos are now opening up businesses online, be it food, clothes, makeup, furniture, and a whole lot of others. There was also the emergence of online barter. Others are even working as temporary drivers. Even multi-awarded rapper and songwriter Glock 9 has entered the world of selling food online. He even made a song on how to cook his fried chicken.
Fried chicken ni Glock 9 talagang pwede. Fried chicken ni Glock 9, sige lang sige. Lutong panalo, ubod ng lutong. Sa sobrang sarap, kulang pati tutong. Fried chicken ni Glock 9.
In a Facebook post, the rapper reveals there were some who still questions what he does. But he was quick to point out that there was nothing wrong in selling food, especially amid the pandemic. Glock 9 further emphasizes that no one should be ashamed of their work as long as they are not degrading other people.
Fried chicken ni Glock 9 talagang pwede. Fried chicken ni Glock 9, sige lang sige.
Arlene Delgado, UNTV News and Rescue. We serve the people, we give glory to God.
A low pressure area was spotted southeast of Davao del Sur. State Weather Bureau Pagasa says as of 3 p.m. the LPA was located at 110 kilometers southeast of Davao City, Davao del Sur. This may bring cloudy skies with scattered rain showers and thunderstorms over eastern and central Visayas, Caraga, northern Mindanao, and Davao region. Meanwhile, Metro Manila and the rest of the country may experience partly cloudy to cloudy skies with isolated rain showers due to localized thunderstorms. No tropical cyclone advisory is issued. Presidential spokesperson Harry Roque said he has no personal knowledge about the whole transcription of the speech of President Rodrigo Duterte in Holosulu last Monday. Based on reports, the speech our TVM broadcast yesterday had been edited, and the part in which the president mentioned the issue on ABS-CBN was removed. Allegedly, the statement was before he said he dismantled the oligarchs without declaring martial law. This is the first time the president made mention of ABS-CBN again after Congress disapproved its franchise renewal. Meanwhile, Secretary Roque insisted that editing the president's speech before broadcasting, it is not a policy of Malacanang.
Hindi naman po yan policy, no? I don't think there's ever a policy to that in that regard.
And for the news abroad, here's Kath Dumaraos live from Bangkok, Thailand. Good evening, Kath. What have you got for us tonight?
Good evening, William. Unrest looms over the city of Rayong, Thailand after an Egyptian military delegate who arrived in Thailand, stayed for a few days and went on a shopping trip, was later found to be infected with the coronavirus disease. Also, Brazilian President Jair Bolsonaro described staying in quarantine as horrible. And in Spain, Valencia is trialing an early warning system that involves studying sewage water to help Spanish authorities pinpoint new COVID-19 outbreaks much faster.
Go ahead, Kath. Please tell us why.
Prime Minister Prayut Chan-o-cha apologizes to the people for lax COVID-19 measures in Rayong, which failed to put dozens of visitors in quarantine. As a result, about 1,800 people who went to the same shopping malls as the Egyptian who tested positive now face home quarantine. The Prime Minister also said that all flights will not be allowed into Thailand temporarily until the problems are fixed. He added that there was no need to put the country back under a lockdown. Meanwhile, a Sudanese family in Bangkok whose 9-year-old daughter tested positive of the virus was also found breaching their quarantine orders. The government has released a list of places the family have been to, such as Siam Paragon, Central World, and Terminal 21, so that people can avoid these places for at least 30 days. Meanwhile, in Japan, Tokyo raised its coronavirus alert to the highest red level today, alarmed by a recent spike in daily new cases to record highs, with Governor Yuriko Koike describing the situation in the Japanese capital as rather severe. The resurgence of the virus in Tokyo could add to the growing pressure on policymakers to shore up the world's #3 economy, which analysts say is set to shrink at its fastest pace in decades this fiscal year due to the pandemic. Governor Koike said today Tokyo is in a situation where they should issue warnings to citizens and businesses. She also urges residents to refrain from unnecessary travel. The infection rate in Tokyo is at stage red, the highest of 4 levels in the metropolis system. She also pledged to step up testing for the virus by utilizing equipment at universities. Infections among young people and asymptomatic cases are rising in Tokyo, health experts have noted. Now that Brazilian President Jair Bolsonaro is staying at the Palacio de Alvorada in Brasilia, he says he is feeling well despite going down with COVID-19, but says it's horrible. He also awaits the result of another test for the disease. Chris Perez will tell us why.
He can't stand the routine of staying at home. This was pronounced by President Jair Bolsonaro, describing staying at home as horrible in a televised interview. The Brazilian president has been in quarantine nearly a week after testing positive for the new coronavirus. 65-year-old president announced on Monday he would be tested again for COVID-19, expecting the results to come out hours after the test. President Bolsonaro says that he feels very well and has no fever or problems breathing. He also has not lost his sense of taste, one of the most common symptoms of COVID-19. He says that if everything is fine, he will go back to work. But if it's the other way around, he will have to wait a few more days. During his weekly Facebook Live post Thursday last week, President Bolsonaro said that after feeling unwell, he had started taking 1 hydroxychloroquine tablet every day. The drug, originally tested to fight malaria, has not been formally proven to cure COVID-19. The far-right president has dismissed the seriousness of the disease since the beginning of the crisis and criticized measures ordered by governors in different Brazilian states to curb the infections. Chris Perez, UNTV News and Rescue. We serve the people, we give glory to God.
Elsewhere in Spain, Valencia is trialing an early warning system that involves studying sewage water to help Spanish authorities pinpoint new COVID-19 outbreaks much faster. Valencia has registered one of the lowest COVID-19 infection rates among Spain's major cities, and this system of testing is intended to make sure that it continues. The process takes 8 to 10 hours, according to Guillermo Garcia, an analyst with the Global Omnium, a company dedicated to water management. Wastewater samples are taken from 24 locations around the city. The aim is to monitor any infections, which could then allow the authorities to take preemptive measures in the event of a new outbreak. The system was developed in conjunction with the University of Valencia and specialists at major water companies in the city, and now they are looking beyond. And those are the reasons behind the news here in Thailand and in other parts of the globe. Back to you, William.
Thank you, Kath, and you stay safe there in Thailand.
People are more likely to be optimistic than pessimistic most of their lives, researchers say. Jovic Belmas tells us why.
Researchers from Michigan State University, or MSU, found that people continue to increase their optimism in life throughout young adulthood, seemed to steadily plateau, and then declined into older adulthood. The study, published in the Journal of Research and Personality, considered the largest of its kind, questioned over 70,000 American, German, and Dutch people between the ages of 16 and 101 to measure their optimism and their outlook about the future. William Chopik, assistant professor of psychology at MSU and the lead author of the study, said they looked at their life events such as marriage, divorce, a new job, retirement, health changes, and loss of significant others. Chopik noted that, surprisingly, hard things like deaths and divorce really did not change a person's outlook to the future. People tend to subscribe to the life is short mantra and realize they should focus on things that make them happy, he added. While Chopik also explained that from the time people are 15 to almost 60 or 70, they become more optimistic regardless of life's good and bad circumstances. The study also showed, however, that health-related concern is one of the main reasons why there is a decline in optimism as people turn into late adulthood, though the elderly are not full-fledged pessimists, he added. Chopik concluded that suffering from terrible events, illness, or going through another crisis do not cause fundamental change in humans, but rather still optimistic about the future and what life is ahead for them on the other side. Jovic Bermas, UNTV News and Rescue. We serve the people. We give glory to God.
And those are the reasons behind the news, July 15, 2020. I'm Angelo Castro III. We serve the people. We give glory to God.
And I am William Theo. Because we need to know, we will always ask why. Have a great evening, everyone.